Good afternoon, everybody. This is Pacific Island Playlist number 5, and I'm sitting here with Jess Morton. Jess is a nurse in Nepean Hospital. She's mum to 2 fantastic boys. Jess, that was a really powerful piece of music. Can you tell me why it's meaningful for you?
This song, I guess, first became my anthem when I was deep in the throes of quite severe, debilitating depression. I was in such a fog at the time. I couldn't sleep at night, I couldn't stay awake during the day, and quite simply, I just stopped functioning. I decided I didn't want to be alive anymore because I felt like I wasn't living anyway. And over a period of time, I made a series of planned and decisive actions and attempted to end my life. My attempt was discovered and I was found, and I'm here today.
Just, that's really tough, a low period in your life. And can you take us back to that time, and can you tell me how that made you feel?
I remember feeling at the time that my sense of utter helplessness was seen as being melodramatic, and I felt that my suicide attempt was seen as attention-seeking. I thought that I was losing the plot. I thought that I was crazy, and when I look back, I'm sure that quite a lot of other people did too, and I wasn't crazy, I was just a little unwell.
Jess, that's given you a unique understanding. You've been a patient and you're also a nurse, and how does that help you understand the stigma around mental health?
Once I started getting to a point of recovery, I found a lot of research that tells us that there are direct links between how a mental health patient is made to feel in their first encounters with emergency personnel and their treatment outcomes and their willingness to continue help. I realised that if we want to smash the stigma towards mental health patients, that we have to recognise, we have to challenge, and we have to change that stigma.
So Jess, stigma, what does it look like? Where do you find it?
Well, stigma is that patronising or that resentful tone by which the nurse or the doctor or the paramedic speaks to the patient. It could be withholding pain relief from somebody because their injury is self-inflicted. It could be not providing the same level of care and attention to the patient as one that's broken their arm. And of course, stigma is using terms related to mental illness and mental health patients in a derogatory manner, like crazy or he's a nut job.
And Jess, once we recognise it, we need to do something about it. Can you give me an example how we can challenge that stigma?
We have to call it out. We have to call out these behaviours and attitudes because we promise to do no harm, and those things are doing more harm than good. And we want our community to entrust us to come to us when they're in a crisis and not well.
So do you think we can change that behaviour around stigma in mental health?
Absolutely, because ignorance and fear come from a lack of education. We need to educate ourselves far beyond what the DSM is going to teach us. We need to talk to our patients. We need to ask them, well, what was it that led to your decision to stop taking your medication abruptly instead of scolding them? And of course, we need to lead by example. We need to model healthy attitudes and behaviours towards mental health patients and use the correct terminology and language, not just in that patient's presence, but also on the other side of the nurse's station. And so we bring up a new culture of people that have got healthy attitudes.
So Jess, you know, this is a really powerful short segment, and I hate to wrap it up, but you really have the ear of this audience for another 10 seconds. Is there a take-home message you want to leave us with today?
I guess there are colleagues and friends, even amongst us in this room today and in our departments back home, and they would have been battling these things on the inside, and they would have heard these jokes and the sneakers, and they would have laughed them off, but as they sort of felt themselves shrink into a corner, we know that there's a soaring epidemic of suicide amongst health professionals, and if we want to stop that, we have to smash the stigma, and that starts with us.
Jess, thank you so much.